Corns and calluses are a common condition experienced by most humans because of pressure areas on their feet. Corns and calluses are caused from different things. What a corn or a callus is a thickened area of skin where the layers of the skin build up, and often as a protective mechanism for your body to prevent skin injury because of pressure from underneath or from adjacent structures. Calluses often occur over bony prominences or pressure areas between toes where toes rub against each other. Then the skin will thicken and form what we would call a corn. And corns and calluses also can be mistaken for other conditions of the foot. Plantar warts, for example, can be similar to types of calluses that can develop on the foot. The difference probably needs to be determined by your doctor, and it would be a reason for you to be able to see somebody for that. However, most corns and calluses can be treated at home, and I usually recommend in those instances the use of devices to sand away or use some type of coarse material to break down that callus. I've often recommended in many instances emery boards and even 100 grit sandpaper as a way to shave down or to reduce the thickness of calluses. One of the problems with a callus or a corn is that if it thickens significantly, it can start to actually be a cause of pressure to the underlying tissues of the foot and can cause pain, and even in some cases can even cause an ulcer itself underneath if it's allowed to become thick enough and prominent enough. So calluses that cause pain are typically the ones that need to have attention and be treated. So what we'd usually recommend is taking care of the callus at home by sanding it down, decreasing its size, and in some cases even paring it down using instruments to do so. In most cases that's probably not safe to do at home, but in some instances a pedicurist, well-trained, can do so very successfully and be able to reduce the thickness of calluses. And if not so, then you need to see your podiatrist or your foot doctor to reduce the sizes of those calluses and to try to prevent them from returning. Also, a home remedy that can be helpful is the use of soaks to soften up calluses, and then to prevent them from thickening as well. Moisturizing creams can also be really helpful in reducing that pressure. And then if you find that the pressure is being produced by some type of either a toe causing pressure against an adjacent toe, or from pressure on the outside of the foot because of a prominence, then choosing to either use a toe spacer or some way of separating toes can help to reduce those calluses. And then in addition, using something in your shoe to reduce pressure, including stretching the shoe or choosing a shoe that has enough space, can reduce the friction that's caused by those calluses. One other type of callus condition can be cracks in the heel, which is a very common condition and a difficult one to treat. It also follows some of the same principles in treatment, including sanding these down, using moisturizing creams and soaks, and then in some instances even going to more of a closed shoe to allow for some retaining of moisture in the foot rather than using a sandal or barefoot walking to reduce some of that pain. You should see your physician for a callus or corn if pain is maintained or continues despite your efforts at home to reduce it, if you start noticing redness or any signs of infection, which include redness, pain, and swelling, or drainage of fluid from or around that callus. And then also, if you start noticing that it's altering the way that you walk because of the symptoms from that callus, then seeing a doctor for this is appropriate. Your doctor, when he or she evaluates this problem, will typically consider using x-rays to search for bony prominences. We'll also shave down very, very effectively these calluses and reduce them to almost a non-existent pressure area, and in so doing can ensure that you don't have an ulcer or a sore underneath the callus, which is not an uncommon condition. And then we'll also give you different types of pads, donuts, other kinds of separators for toes to help you to effectively be able to reduce that symptom or the pressure that's causing the callus. If these items and devices are unsuccessful, surgery again becomes the most appropriate way to treat the causes of calluses. In hammer toes can be realigned or straightened out to reduce the pressure and to reduce calluses. If this is from bunions or bunionettes or Taylor's bunions, then in those instances the bunions can be corrected and it reduces the callus and takes away the prominence that was causing the pressure. For problems that are from bony prominences, those bony prominences can be successfully removed with surgery. In most cases, these are very successful operations, and they're quite minimal as far as the recovery for most circumstances.